Hi, how are you? Welcome to Live United. I'm Kenrick Thomas, the Director of Marketing and Communications for the United Way of St. Lucie County. Each month, we like to have one of our funded partners to come on and talk about their organization and how they impact the community. And today, I have Colleen Phillips from 211. How's everything going?
It's going well. Thank you so much for having me on today.
Well, thank you for coming on, because 211 does a lot of things in the community. You help a lot of people out in St. Lucie County. Before we get started, what is 211?
So 211 is a free and confidential community helpline and crisis intervention hotline. So we're available to residents over the counties we serve 24 hours a day, 7 days a week, 365 days a year to help them locate community-based resources and programs and services that they may not know are available in their area. So we actually handle a 5-county region. 211 is actually a national initiative. So we do have about 93% coverage across the United States, but we are broken down by county within that state. So we handle the residents in Palm Beach County, Martin County, St. Lucie County, Okeechobee County, and Indian River County. So if anyone that lives or is residents in those counties dials 211, it's automatically going to come to us in our resource center that we can be able to refer them to community-based resources.
Really good, really good. Now, what services does 211 provide?
Yeah, so we are fundamentally that basic community helpline and crisis intervention hotline. We do get a lot of calls from people in the communities that we serve that are feeling in mental health distress, that are really looking to obtain resources in our community, but it's also for a wider range of different services. So for people that don't know where to turn for help, we understand how overwhelming it is to navigate the social service system, that we are kind of that gatekeeper and one-stop shop to get them connected to those resources that they may not know are available to them. So we get calls all the time from people saying, I'm looking for housing assistance, utility assistance, I'm in an abusive relationship, parents that will call in saying that I'm worried about my child, where they are developmentally. It's really the full gamut. And then we connect them to community-based resources that we have on our database. Currently, we work with over 1,500 agencies on our database, so we have a really robust community system to be able to refer these clients correctly to what they may not know are available.
Great. Now, you focus strictly on the Treasure Coast, if I'm not mistaken. Okay.
Yes.
Because I think, are you partnered with Palm Beach in any way, or?
We are. So we actually started 211, the history of it actually started down in Palm Beach County. So in the 1970s, we actually started as the local drug and alcohol referral system. And then over the years, we gained funding from the United Ways and different community partners to be able to expand our region. So we've actually grown into the Treasure Coast probably within the last 15, 20 years or so. And that's when we started expanding and joined on to the 211 national network.
Great. That's really good. Now, do you know on average how many people you serve per year? Because whenever someone needs help, they're calling 211. We refer a lot of people from our office to 211 whenever they call us about needs in the community. So I'm pretty sure you get a lot of phone calls.
We absolutely do. So last year alone, we referred successfully almost 100,000 people over the 5 counties we served. Here locally in St. Lucie County, we had referrals of about 9,500 people.
Wow.
We actually have 4 different ways to get a hold of our resource specialists as well. So not only can residents pick up the phone and dial 211, they can actually text us now at 898-211, and it will pop up like an IM screen to our resource people at our headquarters, and we can converse with them non-verbally to be able to get them located to services. So we had about 9,500 calls and texts last year, but on our website, we actually had almost 14,000 hits. So the total referrals that we've offered in St. Lucie County is over 13,500. So yeah, quite a lot.
So
we know the needs are so great over the counties that we serve, especially here in St. Lucie.
And you're really busy at your office too, if you're getting
very,
that
very
many
busy.
calls.
Yeah, and we handle calls from all different populations in the community, whether they're young kids, whether they're teenagers in the school system, whether they're seniors or veterans even. We actually just launched a veteran support line, so we actually have veteran support services as well now through our 211. We also have a Help Me Grow program, which is our pediatric outreach program. So we get a lot of calls from parents in the community wondering where their children are developmentally or if they're reaching their proper milestones before they get school ready. So they can actually call us at 211 and be able to reach out to one of our Help Me Grow specialists, where we can offer free developmental and behavioral screenings over the phone, which is really great.
That's phenomenal. I had no idea.
Absolutely. We actually have another program as well called our Senior Sunshine Senior Wellness Program, where we have our volunteers at our headquarters in Palm Beach County call seniors that are isolated, living at home, maybe disabled individuals. We call them every single day on a time that they specify with us to give them a friendly hello and make sure that they've taken medications for the day, gone to doctor's visits, had a hot meal. And again, it's a way for our resource people to know if we can refer them properly into the community. And again, we find a lot of times that our seniors are very isolated and struggling with that independence. So it's a great way for us to give them that human interaction that a lot of times that they are not, because they could be isolated. So it's a wonderful life-saving program as well called our Sunshine Senior Wellness.
That's good.
Yeah.
Now, besides that, what other phone calls should a caller expect if they're an operator at 211?
Yeah, so I kind of joke that I feel like there really is no wrong call to 211. I really tell people that if it is truly a medical emergency or for crime intervention, you're going to want to pick up the phone and dial 911. However, for any sort of social service issue or human service issue, you're going to want to pick up the phone and dial 211. We get calls, like I mentioned, for all different sorts of demographics, whether it's housing assistance, mental health and substance abuse referrals, people being teased at schools, kids in the school system, adolescent struggles, seniors that are feeling isolated, don't know where to turn for help. And I always tell people too that if you just want to pick up the phone and want someone to talk to that's a non-judgmental ear, we are absolutely available for that too. So we know that there are people that are feeling overwhelmed in our communities and don't know where to turn for help and really lack that conversation that they want to have with someone, and they are absolutely available to call us 24 hours a day.
Do you get phone calls from people who may just want to speak to someone?
Absolutely. Yeah, we get calls all the time for people that have been in fights with their spouses or, different adolescents that are struggling with that independence or maybe gone through their first breakup, and they just want to talk to someone that's a non-judgmental ear, and we are absolutely available for that too. A lot of people have that misconception that we are only there for community referrals, and we're absolutely just here to listen and just to talk through any struggles that you may be having in the community and different things in life situations, and we're absolutely available for that.
So if someone is feeling stressed out, maybe if they're just, brain overload, or if there's, they had a bad day at work or a bad day at home, they could just call 211 just to speak to someone.
Absolutely. Absolutely. And we never want to hinder anyone from utilizing our services, which is why we are a free and confidential community helpline and crisis intervention hotline.
Great.
So oftentimes we do get people that will call us and say, I just don't want to be here anymore. I just want to die.
Wow.
And all of our resource people are trained in mental health first aid and assist, so they are able to de-escalate these individuals and get them connected to community resources where appropriate. So we absolutely understand, and I think we've all kind of been there, that we've all had stressful times in our lives or didn't know where to turn for help, or maybe just have issues navigating the social services. And with our community database of over 1,500 agencies, we're able to properly refer these individuals where appropriate, and also just give them a friendly voice to talk to, a non-judgmental ear, just to go over some concerns and just be there for them in a time of need.
That's great. Now, how many organizations do you work with?
Yeah, so currently we work with about 1,500 agencies over the 5 counties we serve. And that's always growing. I myself work in community relations here on the Treasure Coast, so I'm always hearing of new programs and services in the community, and I'm always trying to recruit them to our free database. So we want to be able to be that community database that has a really robust referral system. And I think it's a win-win for everyone involved. It's great for our community partners to get those referrals to assist those individuals in direct care services, but it's great for us because we can be that one-stop shop. And people that are flying under the radar and don't know where to turn for help can certainly call our easy-to-remember number, which is 211, and we can direct them where appropriate.
And it's great that it's just 211, because when I refer people to 211, they're like, oh, 211, okay, so what's the phone number? And I say, no, 211. And they're like, oh, so just dial 211? It's like, yep. And then
that's it.
You'll get an operator. And they're like, oh, that's great. So that's a really good thing.
Yeah.
Now, as far as, you mentioned this earlier in the interview, so you don't just have to dial 211. You said there's other ways people can get in contact.
Absolutely. There's actually 4 ways to get a hold of our representatives at our call center down in Palm Beach. So you can simply pick up the phone and dial 211 if you're in our service area, which is the 5 county regions I mentioned. So Palm Beach all the way up to Indian River and out to Okeechobee. Or you can text us. If you text your zip code to 898-211, it will pop up like an IM screen to our resource specialist at our headquarters, and we can converse with you non-verbally that way. You can also go to our website, which is 211treasurecoast.org. There is a Chat Now button in the middle of our homepage. You can simply click that, and again, it will pop up like an IM screen to our resource people that we can converse with you and give you information that way. The last way that you can get a hold of us is email. If you email us at help@211pbtc.org, we will be able to check our inboxes within a 24 to 48 hour period to be able to give you those resources.
Great. Now, if someone has a need and it's urgent, how do you prefer for them to just call first, or what's like the fastest way?
I typically tell people to pick up the phone and dial 211, or you can text us at that 898-211 number, and text us your zip code to that 898-211. Those are really going to be the fastest ways to get a hold of our representatives. Our chat is available every day from 10 a.m. to 8 p.m. But our lines are always available 24 hours a day. So if you just pick up the phone and dial 211, it's going to be the quickest and most efficient way to get a hold of our representatives.
Great. So people call you for all different kinds of reasons. So do you know what's the biggest need in the community?
Yeah, it's very interesting because when we pull the data that we see across the counties that we serve, it's very interesting to look at and see what the different needs are within that county. So I actually did pull some of the data that we saw in St. Lucie County specifically, and housing is actually the biggest need that we see here. So last year in 2018, 28% of the calls that we saw here in St. Lucie County were related to housing and affordable housing. So we know that that is a huge epidemic really across all the counties that we serve, but especially here in St. Lucie County for people that are struggling to find affordable housing in this area. Next, we also see that there's a lot of mental health and addiction services for the referrals that we see. It made up about 16% of the calls that we saw last year, which is very reminiscent of what we see across all the counties we serve. Typically, it's a lot of the mental health and addiction services as well as affordable housing as well. We do get a lot of calls for people looking for financial assistance as well, so utility assistance, things monetarily to be able to help them in their day-to-day lives as well.
What about people, so housing, so is it more geared towards affordable housing or people who may be homeless and need a place to stay?
Yeah, absolutely. It's really the full gamut. So people that are looking for, domestic violence shelters, people that are struggling with homelessness issues, people that are looking for affordable housing and recently could have been evicted from their homes and they're looking for a transitional living. It really is encompassing that full gamut. We do find that people very much struggle with, trying to find affordable housing and coming up with that security deposit, first month, last month's rent. Sometimes it's very costly, and a lot of families struggle with that. And, for people that are working full-time jobs and have families with children, it's hard to come up with that monetarily, just to give that over to a landlord. So we're able to assist them and try to find some lower income housing, HUD subsidized housing, things of that nature. So it all kind of really plays into that housing issue.
That's phenomenal. So let's say, for instance, someone is watching this show and they want to volunteer or donate. How can they get involved? Do they dial 211 also, or is there another process?
You absolutely can. So you can reach out to us at 211, or you can actually go to our website. We have a donate portal through there. So if you go to 211treasurecoast.org/donate, or just go to our main homepage, you'll see a donate button on our homepage there, and we absolutely rely on our community partners to fund the life-saving services that we offer.
What about if someone wants to volunteer? Is that an option as well?
Absolutely. We have a wonderful volunteer coordinator at our headquarters, and we absolutely rely on our volunteers as well. So if anyone is interested in that, they can certainly go to our website again, which is 211treasurecoast.org, and look at the volunteer opportunities there.
Great. Now, one more question as well. Now, funding, where do you get the bulk of your funding?
Yeah, so we actually work very collaboratively with a lot of our community partners, and they really include quite a wider range of people. We work with our Board of County Commissioners in Indian River, Martin, and St. Lucie counties. We do get funding from the Children's Services Council of Okeechobee, Martin, and St. Lucie counties, the Hope Sound Community Chest, the Indian River Sheriff's Office, the National Suicide Prevention Lifeline also gives us monetary money there. We also get a lot of support from the Southeast Florida Behavioral Health Network and the Help Me Grow Florida initiative. We also get a lot of donations from the different United Ways we have across our 5-county region. So that includes the United Way of Palm Beach County, United Way of Martin County, United Way of St. Lucie County as well. We're very grateful for their support, and Indian River and Okeechobee as well. Great,
so that's really good. So 211 provides a really great service. I really appreciate you coming on today talking about it, and we definitely have to do this again.
Yeah, absolutely. I'd be happy to come back.
Thank you so much.
Thank you.
Thanks for watching.
I'm lucky. Let me help you with that. I get to do something I love. It has nothing to do with touchdowns or titles. Everybody bring it in. I get to play a part in the life of someone just starting out. How many of you think homework is just as important as teamwork? I help keep kids in school. Good. And that's the name of the game. My name is LaDainian Thomason. I don't just wear the shirt, I live it.
Give, advocate, volunteer. Live United.
Welcome back. On this segment, I have Lori Sang, the Executive Director of Light of the World Charities. How's everything going?
Very well, thank you. Nice to see you.
Nice to see you as well.
Thank you for inviting us today.
This is a different time. I used to see you all the time at networking events. Now,
right.
Now we're doing an interview, which is really good.
Thank you for the opportunity.
You're welcome. Now, tell us a little bit about Light of the World Charities, what it is that you actually do.
Light of the World Charities, through Little Lights Dentistry Program, we provide free dental care to uninsured children that live in poverty. So families that live up to 200% of federal poverty level and don't have Medicaid or private insurance for dental care, their children are eligible to come to receive dental services through Little Lights Dentistry.
Wow, that's really great, because I know that can be a big issue, definitely in our community,
yes,
as far as access to quality dental care for low-income
Absolutely.
people.
And you know what we've found is that, first of all, untreated dental decay is the #1 cause of preventable disease in children, according to the American Dental Association. So what we want to try to do is make sure that children understand the very basics of oral health care, brushing twice a day, flossing, and using, doing an intake of healthy foods for themselves. So reducing the amount of sugary foods like sodas and candies and ice cream, those kinds of things, which we can have, but just not every day, all the time. So we're looking at a multi-pronged approach to working with families and trying to educate them about good oral health and good nutrition, for not only for their child, but for their whole family.
And I also hear that it actually, a lot of students miss school because of this issue.
It definitely increases absenteeism, not only from school, but from other activities that the child may have an opportunity to participate in. So just imagine sitting in a classroom with a toothache. You're not going to really be able to concentrate, and you're not going to be able to participate in the class. It also impacts a child's self-esteem and how they feel about themselves and how they present themselves to the world. So we want to impact all of that.
Great, great. Now, what services do you actually provide?
We provide comprehensive dental care, everything from cleanings to tooth extractions and root canals and crowns. So whatever a child's dental services require, we're going to try to provide. If there's something that's really intensive or it takes a longer period of time to provide the treatment, we'll refer to a community provider that may be able to do that treatment using IV sedation. We don't do anything like that in the office, but we do use something called conscious sedation, or the use of nitrous oxide. So when they're giggling in the back, I know that they've got a child in there that they're using the nitrous on, but it just makes it easier for the child, and it makes it a more pleasant experience for them. Because we don't want children to grow into adulthood fearing going to the dentist. So we try to make it as pleasant for them as possible while we're still getting the medical treatment, the dental treatment that they need.
That's phenomenal. How did you get involved with this organization?
Well, I started as a contracted grant writer 5 years ago and became a volunteer, and then they offered me an opportunity to come on staff as the funding officer, and then that developed into the position of executive director.
Great. So if someone's watching this show and they want to volunteer or donate or even become a patient, like what is that process?
Families can self-refer. We get about 52% of our referrals come from family referrals, referring one family to another. They can just contact our office at 772-223-9785 and make a referral for an appointment. We will do an intake with the family just to ensure that they meet the financial criteria for eligibility and to ensure that they don't have private insurance or Medicaid. Since we don't charge families for those services, we do need to make sure that everyone that comes through the door does certainly qualify for it.
Great. Now, I believe, I'm not sure if you're aware of this, maybe you are, but I believe Light of the World Charity started out as a dental service for adults.
Right, it actually started as a medical missions program.
Oh, really? Okay.
Back in 1996, a woman by the name of Teresa Banks, who was a registered nurse, she began this organization and felt the need for medical professionals in the community to come together and go once or twice a year on their vacation and travel to South and Central America doing surgical procedures and dental care. in 2015-16, it became just too dangerous to travel abroad in that kind of capacity. So the board took a step back and realized that locally, because we were still providing surgical and dental care in the local community, but realized that there was such a gap in services for children that didn't have insurance. There were no dentists that were willing to provide care. So in collaboration with the Martin County Oral Health Coalition, Light of the World Charities came to the table as a partner and created Little Lights Dentistry. So since 2016, we've been located on the campus of St. Joseph's Catholic Church in downtown Stewart. There's a composition of nonprofit organizations that are also on that campus with us. There's Catholic Charities, and Early Head Start is there along with us, and St. Joseph's has a soup kitchen on Mondays. So it's a great community area for families to come whenever they need any kind of service. So in 2016, they opened Little Lights Dentistry, and we've been providing services since.
Great. So now Light of the World Charities is strictly for children.
Correct. And we only provide dental care. So
Dental
the
care.
program that we have is called Little Lights Dentistry.
Great. So pretty much, I believe there's also another organization called Christian Community Care.
Christian Community Care Center, yes. They're located in Stewart on East Ocean across from Stewart Middle School.
Okay.
They provide care for adults.
Adults, okay.
And we also partner in St. Lucie County. We partner with the Hands Clinic and
Hands
United
Clinic,
Way.
yes.
Of course, we're a newly funded program through United Way, which we're thrilled.
That's great.
Thank you for that. And as of this week, we've served 100 children from St. Lucie County in this calendar year. So
Wow.
we are expecting that we're going to be able to really meet the needs of the children in this community. There are no other providers that offer free dental. So it's definitely a critical need in the community. We see about 18% of children live below the federal poverty level. So that's a huge number of children.
Yes.
If we're just looking at the Treasure Coast, that's thousands of kids.
Yes.
So we don't want them to go to bed at night with a toothache. We don't want them to miss school because they're uncomfortable or they're in pain. And we certainly don't want them ending up at the emergency room because they've got an abscessed tooth that needs to be pulled. We just don't. Those are the things we want to prevent.
Yes.
So by going in and really working with the family and helping the child at a young age, we're making a difference in their lives.
Great. Now, do you know what could be the reason why there are a lot of children who don't have access to quality dental care?
Insurance is the #1 barrier for families. You know, as economic times become very difficult and families' budgets are stressed, oftentimes, and this is universal across the board, oftentimes dental care kind of is one of the first things to go. So, you know, it's not a priority. If you need to put food on the table or pay your rent or pay the electric bill, those are the things that are going to come first. So as a parent, we're always going to try to do the best we can for our children. If we don't have the money to get the dental treatment, it's just not going to happen. So we need to be able to make our services available to any child that falls into that category, whose family does not have the money. They may be considered working poor. They may be working, but they're living paycheck to paycheck, and they just don't have the money to get the services for their child that they need.
Wow. Now, do you have any upcoming events coming up?
We do. We have
Great.
2 in early 2020. We have the first one is going to be an evening at the Lyric. It's an evening of music at the Lyric Theater. There's a show called Bravo Amici, and that is February 20th, 2020, so 2020, at 7 o'clock. And we'll have a cocktail reception at the Jeffrey Smith Art Gallery on Osceola Street, which is right behind the Lyric Theater in downtown Stewart. So we'll do a cocktail reception there, and then we'll all walk across the street to the Lyric together. It's going to be a wonderful evening. We're selling only 100 tickets at $100 each, and so it'll be a small, intimate gathering. The other is we're having a bridge tournament on March 1st at Harbor Ridge Yacht and Country Club in Palm City. So that'll be a whole afternoon from 2:30 to 2 o'clock rather to 7 o'clock. So we'll play bridge, or they'll play bridge for the afternoon, and then we'll have a cocktail reception and silent auction after that. So there's a highly competitive bridge community on the Treasure Coast. So we've gotten a really nice interest in that event, and tickets for that are also $100.
Great.
So if anyone wants more information about either of those events, they can go to our website, which is lightoftheworldcharities.org, or they can call our office at 772-223-9785 for more information.
Great. Now, what other organizations do you partner with?
We have a whole host of partners because, of
great.
course, no organization can do this by themselves.
Yes.
So our funding partners include United Way for Martin and St. Lucie, Children's Services Council of Martin County,
Great.
Allegheny Franciscan Foundation, they partner with us. So does the Florida Association of Free and Charitable Clinics. Those are our major financial partners. As far as agency partners, we work with House of Hope, Tykes and Teens, St. Joseph's Church, Head Start, Early Head Start, Healthy Start, anyone who serves children under the age of high school graduation. So we work with children from birth through high school graduation. Or as soon as their first tooth erupts, we want to educate families so that they know how to start cleaning their child's teeth. They're not going to brush them. We want to teach them how to clean them and develop good oral health home care routines for the child. So we partner with whoever works with children.
That's great. Now, also the Hands Clinic, they have a dental pediatric program
Yes.
as well. How does that partnership work? Are they more like a referral service to
Yes,
you?
so this is a new collaborative for us with the
Okay.
Hands Clinic. And what they do is they provide dental screenings to all of the children in St. Lucie County public schools. So about 18,000 children a year. So they'll screen those children, and then any child that needs follow-up dental care, if they have insurance, they'll be referred out to a provider that accepts their insurance. If they have Medicaid, the same thing. They'll be referred to a provider that accepts Medicaid. If they don't have insurance, they will refer to us, and we'll be able to provide the service. The challenge, though, is that there's no public transportation system for families to travel from St. Lucie County to Martin. Even within Martin County, the public transportation system can be a challenge to navigate. So we have to rely on families to be able to provide their own transportation. But so far, we've been able, like I said, to serve about 100 kids. So we think we're going to be okay for now. That may be a challenge that we have to really address later on as a community, but for now, we're working individually with families to make sure that they can get to us.
That's phenomenal. So your organization has a big impact in the community. How does it make you feel to go to work every day knowing that you have a big impact in
First of all, the
children's lives?
staff that I work with are amazing.
That's good.
So it's multicultural, multinational. They're just a great group. There's only 6 of us. It's a very small staff.
Okay.
So you have one dentist, one hygienist, one dental assistant, a dental coordinator, an office manager, and myself. And so working with them, they're very committed to children. They're very committed to the mission. And they want to see children healthy and thriving. And they understand that poor oral health can lead to additional health problems down the road. Obesity, learning disabilities, cardiac issues. So there's all kinds of things that we can prevent by providing good dental care. So, and it's fun. You know, they love working with the children, and it's great to see the kids that come back over and over again because we know that their family is committed to helping their child be the healthiest that they can be. And we're striving to teach families healthy habits for life. So that's what we're trying to do, and we have fun doing it. So it's a great place to work. I love it.
Great. Now, how can someone get in contact with you?
The best way is just to either go on our website and go to the email opportunity there to contact us, which is info@lotwc.us, or they can call our office, again, at 772-223-9785.
Great. Now, as far as Light of the World Charities, where do you see it going in the future?
We see it really expanding out. There's so many opportunities to serve children that don't have insurance. So we really want to focus on the Treasure Coast area to make sure that that a child who needs care can come to us. I really see us being able to, especially in St. Lucie, establish firm partnerships. We've just created one with Indian River State College. So we'll be a placement site for their students for dental hygiene and dental assisting. So they'll come to us as a work site towards the end of their educational training. So I think that's a great opportunity for us. Working with the Hands Clinic is wonderful. Florida Community Health Center. Whoever is working with children in St. Lucie County, we want to partner with them to ensure that those kids who need dental care have a place to go.
Great. Well, thank you so much for coming on. I really appreciate it. I think your organization does a really great job in the community, and we definitely have to do this again.
I'd appreciate it. Thank you very much.
Yes, definitely. Thanks for watching.